To open our forum, we have Associate Professor Peter Gonski, who is the Director of South Care, Aged and Extended Care, Sutherland Hospital, is also the South Eastern Sydney Local Health District Board Deputy Chair. As a Senior Staff Specialist Geriatrician, Associate Professor Gonski holds many senior roles, including Director of South Eastern Sydney Local Health District Aged and Rehabilitation Clinical Stream, as well as being on the boards of South Eastern Sydney Medicare Local and the St George and Sutherland Medical Research Foundation. He is a conjoint Associate Professor of the Faculty of Medicine, University of New South Wales, and Head of the Sutherland Clinical School. I invite Associate Professor Peter Gonski now to open our forum with his presentation on the work and successes of the local health district in southern Sydney. Please welcome up Associate Professor Peter Gonski.
Good evening, everyone. It gives me great pleasure to welcome every one of you to this Southern Sydney Community Health Forum. I'd like to acknowledge our traditional elders, past and present. I'd like to also welcome Minister of Health and Minister for Medical Research, Gillian Skinner, Minister for Mental Health and Minister for Healthy Lifestyles, Kevin Humphreys, the Director General, Ministry of Health, Dr. Mary Foley, and our Chief Executive, Mr. Terry Clout. Being the Deputy Chair of the South Eastern Sydney Local Health Districts Board is rewarding on many levels. The Board is able to play a significant role in making our district an area of positive outcomes, excellent patient management, minimising incidents, improving and providing quality models of care. In 2011, a very important change occurred in New South Wales Health. That was devolution. Under the Honourables Gillian Skinner, the management and governance of hospitals was given to local health districts, which are governed by local health district boards. What this change in governance represents is that decisions about local matters are being made by the very people who work in frontline health services with consumer involvement. From clinicians to hospital managers, staff are engaged and informed on budgets, resources, models of care, and how healthcare services are delivered. At South Eastern Sydney Local Health District, which covers Sydney Eye Hospital in the north, the Prince of Wales Hospital and Royal Hospital for Women, both at Randwick in the east, St George and Sutherland Hospitals and the Garrawarra Centre, all in the south. There are 13 board members who provide a wealth of experience and local knowledge. A number of them are here today. They come from a vast range of backgrounds. There's local clinicians, a GP, businesswomen, businessmen, and community representatives. The board and the chief executive are responsible for improving local patient outcomes and responding to issues that arise throughout our local health district. They are also responsible for monitoring the performance of our local health district, delivering services and performance standards within an agreed budget based on strategic and annual operating plans, ensuring services are provided efficiently and accountably, and producing annual reports that are subject to state financial accountability and audit frameworks. Local decision-making is done in conjunction with clinicians, management, and community representatives at hospitals through clinical councils. Those decisions are then reported to the board, who are held accountable by the Minister of Health. The process allows for local flexibility and responsiveness so that hospitals and health services can engage with patients and the community in the design of services to meet individual patient needs. It also allows for local linkages to be built with GPs, with Medicare locals, other health and social services which are required to support healthy communities. Importantly, staff and clinical engagement are at the core, ensuring our doctors, nurses and allied health professionals are engaged in the design of models of care to ensure quality, safety and effectiveness. The South Eastern Sydney Local Health District Board meets with clinical council chairs throughout the year, and if an issue arises at a hospital, the board invites the hospital's manager and clinical council chair to address the board. This process ensures accountability and transparency. As a clinician, I'm proud to work in the local health district that has a highly skilled team of doctors, nurses, allied health and ancillary staff who are at the cutting edge of healthcare delivery. They are passionate about providing the best care, putting the patients at the centre of everything they do. It is important that our healthcare services meet the needs of everyone in our community so that everyone is able to obtain optimal health and well-being. Access and equity to our healthcare services by all our community remains a priority for our local health district. Our local hospitals have a long, proud history of community involvement and support by way of volunteering, donating and fundraising. The community contribution is absolutely outstanding. It's very much appreciated and incredibly necessary. Tonight offers an opportunity for the community to come together and hear some of the wonderful innovations which we are doing at South Eastern Sydney Local Health District. It is also an opportunity for you to have your say, to ask questions and to gain a better understanding of healthcare in your community. I hope you find the forum interesting, helpful and enjoyable. Thank you.